loves. I just wanted to jump on and do a quick video regarding my client's care plan and her diagnosis. Here on the rubric it says to discuss the choice of this diagnosis and why it's important. So to read it out loud, the diagnosis that I chose was deficient knowledge about strokes related to insufficient education and information as evidenced by a history of recurring TIAs or transient ischemic attacks, insufficient knowledge and inaccurate follow-through of information. This care plan was made in her presence. We kind of collaborated on it, and out of the difficulties she was facing with, just blood disorders and bowel incontinence and history of strokes, we determined that this was the most appropriate because we think it's the most life-threatening for her, and we want to make sure that she has appropriate knowledge on it and she can detect warning signs and that she's able to adequately prepare so that, she doesn't experience this again, because she told me that her doctor had told her, like, the next one is it. If you have another one, it's going to put you down and it's going to be major. So we're doing everything in our power to prevent that. So to talk about my short-term and long-term outcomes, for my short term, I said by 1500 today, which is the day that we did our original meeting, the patient will utilize the teach-back method for risk factors for strokes. And I think this is really important for older clients because communication and understanding sometimes can be a challenge to them. So I wanted to use this method so that she could put it in her own words and that she could verbalize it herself. And I think that this really helped her to understand, okay, this is my understanding of it and this is how I can apply it to my own life, and it's not just something that someone else was instructing her on. And then the second one was by 1500 today, the same day, the patient will be able to identify 3 warning signs preceding a stroke. So whether this is numbness, facial drooping, speech slurring, or even signs that happen way before the stroke's actually occurring, we wanted her to be able to identify those things so that she can understand and see, how you can, I guess, determine or detect if a stroke is happening or if, you are in the danger zone. And then a long-term outcome that I chose was by the end of our teaching through the course of the semester, because I wanted to hopefully be able to evaluate this by the end of the semester. That's why I chose that time frame. The patient will verbalize understanding of the stroke process, treatment, rehabilitation, and potential outcomes. So luckily for her 4 TIAs that she's already had, she really hasn't had much rehabilitation. I think they did some speech therapy with her just to ensure that, that she was able to verbalize correctly and understand and process and form sentences and words and conversations. But as far as physical therapy and things like that, she was very blessed and very lucky. So that is discussing her short-term and long-term outcomes. I will post this on the slide that correlates with that.